Well, thank you very much for coming to talk to me today about prostate cancer and about your experience with treatment. Can you tell me a little bit about how you got diagnosed and then about how you decided for treatment?
Sure. Well, I had run regular checkups with my doctor, my primary care, and my PSA was starting to show elevations, and that was changing, and so it triggered a follow-up. And when the follow-up came up, the PSA was elevated, and it was considered that I might need to do or get prostate surgery or some treatment for prostate. And so I started to look into it a little bit. I knew that there was some concerning operations. Some of the procedures that were out there were really concerning to me, and I did a lot of research. This could be a long discussion because it took me a while, but the short version is that I ultimately decided to go with your services, the high intensity focused ultrasound as an alternative to surgical procedures that were, or radiology that was proposed. And I did speak with radiologists and I did speak with surgeons. Neither of them could guarantee me that there was going to be a minimal amount of impact on my sexual organs and my sense, my sensation in that area, which to me as an adult male were important considerations. And so the radiology procedure, that was going to be at least 8 weeks. There were 5 treatments, 5 treatments a week for 8 weeks. That was an extraordinarily intrusive and time-consuming process with a lot of side effects. Surgical procedures were outlined, and those were going to have side effects, including the possibility and the likelihood, because the doctors were very candid about this, that they were going to cut one of the key nerves. Because they're going in there and they're cutting out the prostate, and so inevitably some of the nerves that are in those areas are cut, and that was going to affect sensation and other kinds of experiences that as an adult male you're accustomed to having. I was genuinely concerned about all that, so I did my homework. And after reading a number of articles and looking for a practitioner in the area, your name was prominent among them. There was a lot of high recommendations, a lot of commentary about the quality of your services, and I contacted you and asked you to do the follow-up. So you ran blood tests, got a high PSA rating, then we did the procedure where you go in and take some samples to look at the tissue, and that tissue showed that there was indications of cancer in the prostate. So right down the line, every step of the procedure, without enumerating every single step, and I have written them all out here, and I thought that was useful. A customer had, a friend of my brother's had asked me about because I had gone through it, and my brother's friend said he has likelihood of prostate. What would you talk to him? And I did, and I enumerated, every step of the way. But the point of it being that you guys are very attentive and professional and responsive, which I found a welcome change from a lot of the experiences I had had. You have a patient portal where all the information is made available and I can look it up immediately online. You've given me your cell phone number, and if I needed to, and I did in a couple of occasions, I needed to reach out to you, you responded. I have other physicians that don't return calls. That's my experience. And so I was struck, and I mean, this is at a time of a great personal upset and challenge to see that the guys, you were so supportive, your staff is very friendly and supportive. And that meant a great deal. And as things proceeded, there's a succession of treatments that have to be done. One, the test to determine that there is where the cancerous cells are, and then the TURP, the transurethral recession of the prostate procedure, was recommended and was done. And then after that, in the recovery period, then the HIFU, the high intensity focused ultrasound, was done. In between the period of recovery, that was a period where I needed to have a catheter, and I had a little difficulty with that. Your staff was very helpful with the catheter. It's not something I've had before, so. But I liked how everybody was so responsive and made themselves available. And at the end of it all, I wanted to kind of conclude by saying that the procedure was successful. My prostate is now, my PSA levels is at 0.86. Previously it was at 9. And so it looks very much like the whole thing has been very successful. My sexual function has not been affected. My sensation and passing of urine, all that is going normally. Very relieved about all that, and so I feel like the whole experience has been very successful. And I'm deeply appreciative of the service that you guys have given me. So that's a short version. I mean, there's a lot more detail if you wanted detail, but I mean, that's...
Oh, thank you very much. It's very meaningful, and I'm sure that people who are watching this video are going to find your words very, very helpful.
Yeah, I think having the someone who has actually gone through the process speaking from their experience is probably very helpful. And I can highly recommend, for those of you watching, I can highly recommend Dr. Gluck and his staff. They're very attentive and professional and highly competent and very impressive. Thank you.
Thank you very much.
Thank you, Dr. Clark.